Hi, again. I think this time you don't have to crane your neck. It's still Hannah.
Hello.
It's still me, but this time it's a little bit better, hopefully. So, welcome back to our Facebook Live on this amazing fall Thursday morning. And we're still talking about cancer. We were going to do that for a 4-week series. And we had the opportunity to hear from Dr. Zach initially, a little bit from Melissa last week, and today we have Hannah. So Hannah, there are some folks on watching us that know you well because they're patients here, but there might be some other people that do not. So give me a sense of your background and where you came from and what you do here at the clinic. Start there.
So I'm Hannah, obviously. I'm one of the nurses here. There are 4 of us, and we do a lot of IVs and talking to patients and stuff. And before I worked here, I worked at a hospital locally for 8 years in the ICU, so did a lot of IVs there. None of them were like the IVs we do here, which is vitamin C and nutrients, but quite the different atmosphere.
Yeah. So would you say then that our approach to IV therapy, or what we do with it, how we use it, is really pretty different from your background?
Vastly different.
Vastly different. So on that point, since we are talking and emphasizing, our discussion is really around cancer this month, maybe, and I know you've gone off to a lot of training as you've worked here for the clinic, you've gone to some clinics that we're shadowing and learning from. So maybe talk a little bit about IV therapy specifically and IVC and how it addresses cancer. Like, what does it do, or at a high level, how does it work?
So at a really high level,
that's all we can handle because a lot of us are not clinical.
Well, side note, there is clinics that do very low dose vitamin C and nutrients, and that is not the same as what we do primarily. We do high dose primarily. So there is like cancer patients, depending on what level they need, they'll get 50 grams, 50,000 milligrams of vitamin C. Super high potency, all the way up to 75 and even higher if we need to.
So just as a little compare and contrast, because now you're talking, metrics and different, we're used to inches and pounds and yards and not milligrams necessarily in the United States. So when someone takes a capsule of vitamin C, as a for instance, how many grams? One.
So by ID, it's 50,000 of those pills all at once in your IV.
So when you take a daily dose of vitamin C, on average you might be taking 1 gram, and here we're doing 50 or 75.
Yeah,
so
and that's for cancer patients.
Yeah.
Yes.
Yeah.
So we do lower doses for people who do not have cancer. At a high dose like that, it's oxidative, so it kills off things. It's not antioxidant, so it's not supporting your body to make itself get better. It's killing off things like the cancer. We don't say it kills cancer, but we do say it supports your body in that process of healing. So, but those other clinics around are giving you small doses of vitamin C, probably a 1 gram, even maybe a little bit higher, but definitely not unless they are specific for high dose vitamin C like we are, 25, 50, 75 and higher. So massive difference than a walk-in clinic, I guess.
Yeah,
and
that's fair. And I think we're starting to, a lot of us, become more familiar with IV therapy just in general, but more specifically what we do here is high dose C. So there might even be other places that people are familiar with, and understanding the difference between what they do and what we do would be important. So that gives us some perspective of what's mostly in there. What else? Is there anything else in those IVs other than vitamin C?
Again, if you're, depending on what your formula is per Dr. Lori's orders based on your labs, you can have B vitamins, magnesium, and then lots of C. Sometimes our patients that have cancer do a high dose vitamin C alternating with the nutritional, which has more of the nutrients, the vitamins, the minerals, as well as glutathione, which is a massive antioxidant, detoxer. Cleans you out cleans your body, your cells out after getting the chemo. So there's definitely a wide range of what formula you get based on the history and what Dr. Lori wants for you.
So we have the ability to customize that a little bit, you would say. Now you mentioned 50, 75, 100. How would you and the clinical team here know what's right for someone?
So we draw a post-IVC level, and that is run by a lab that we went to visit, and they're like the leaders in vitamin C therapy. They've been doing it for 40 years, probably at least. And so they have a lab that they test at their facility. It just shows you how high your vitamin C level is after I give you an infusion. And so if I gave you a 50 and that level was too low, then we would know we need to go up, and so on. So.
And the beauty part, we test it, and I love that we test it. I love this whole idea of testing and learning, and testing and knowing, more importantly, what's right for someone, because essentially we don't want people to have to pay for more than what they need.
Right.
So that's an important part of the process, I would say. Now, this is true of me and Shelly. I saw your story on you're watching and you're commenting, and I appreciate that. But before I came to work at the Livewell Clinic, I might have occasionally passed out when I gave blood. I might have had a general fear of needles, even though I don't have a fear of much else in my entire life, except maybe drowning. That's another one. Now my true vulnerabilities are coming out. And yet, I continue to voluntarily submit myself to this about once a month. And I think there are probably some people out there that still associate IV therapy with something emergent. This idea that we would do this like on purpose, routinely, day after day or week after week. So let's talk a little bit about generally the experience. So what is it like? What can people expect when they come for an IV therapy session?
So it's pretty, I wouldn't say quick. It depends on you and your life, of course, and how busy you are, but typically an hour. If you are a cancer patient and you do need more, then it's going to be up to 2 or even higher of hours.
So depending on
your
the
formula.
50, the 75 grams, the 100 grams. Okay, so you're going to not necessarily give the same amount in the same amount of, or a larger amount in the same amount of time. Right. You'll adjust how long someone is. Now, why? Why is that important?
Everyone responds differently to how much they get in their body's health, and so if we give it to you too fast, you'll get sick. Okay. Or too slow is what we try to do for those people that tolerate a slower rate. We try to slow it down. We change up the recipe, whatever needs to happen, just so that you tolerate it better and you don't feel sick. So about an hour though is a typical. The general population does it.
Okay. And what's, for those of you that haven't been to our clinic, I mean, I guess talk about what's the goal? Like, other than obviously addressing cancer and other things that people have going on, but what is that space just generally like back there?
I try to keep it quiet,
which is why I'm not allowed to go.
Just to once again support people that are back there. A lot of people bring stuff to work on, or read, or even just headphones with music. A lot of people take naps lately. This week, I think we've had a lot of nappers, which is great. I'm always jealous of the nappers. So it's just kind of a calming atmosphere for people to feel.
Yeah. We like to see people limit the use of cell phones and doing a lot of work. I do see people back there a lot with a book, which I think is a great use of that time. I do see people connecting with other people, so having conversation.
Lots of connecting back there. I think that's a huge thing that people that don't get IV therapy miss out on, because I get to see them once, twice, 3 times a week, and I'm not just I'm so important, but I get to, how's everything going? Do you have a question today that I can help you with today? And so I have a lot more interaction, but they also share, like, where do you get your beef from? Can I buy beef from you? Or tell me about your story and things like that.
And I've even seen people that have been having IV therapy for a while really encouraging those patients that are newer to the process. So I think that's really important as well. So we've got restful, relaxing, we've got people reading and taking naps. I'm truly jealous of that. I'm assuming from that it must not be painful.
No.
Or could it be hard to sleep if it hurts?
That is a big, like she was saying about her fear of needles. That's only in the initial part. Sometimes there's pain, but it's very rare, and we always try to work to figure out why, because it should not be painful. After we put in that initial poke, which is painful, don't get me wrong, it should be over, and you should have an hour of non-painfulness. That's our goal. So
and I think that you guys do a great job with. Sometimes a little bit of heat will help. With heating pads and those little.
Yes, some people have very difficult veins, especially cancer patients. Their veins have typically been overworked and overused, and so we really try to work on our skills and helping people not be in pain, like she said, with heat, or we have different little techniques that we've learned from the clinics we go to watch what they do and just how to get the IV in easier and not have so much
Yeah.
issues. So.
Now, if people are, what are some of the tips and tricks that I guess you fill people in on to get ready for an IV therapy session? I mean, what are the
Eating a
things?
good meal.
Oh, yeah.
That's huge. A lot of people will come and they will not have eaten, and then they will feel horrible. Vitamin C is like glucose in the body, so your blood sugar sometimes will drop, and if the person's not eaten that day, then they'll feel worse, of course. So then we always have bars back there just in case, and that typically fixes it right away. Lots of hydration, of course. Drink lots of water before you come.
Which, by the way, is a good idea anyway. But particularly on blood draw days and IV therapy days, for sure, a little extra hydration. And I remember you telling me once very specifically, like, Christina, eat a meal, not a snack, a meal.
Yes.
So obviously, a more full stomach is useful
Right.
to help people feel a little bit better.
Not some rabbit food of lettuce.
That's right.
Some meat.
And so, takes about an hour, doesn't hurt, relaxing, calming, napping. I mean, to me it sounds amazing, other than
Right.
all of the health benefits which exist too. I know that when you're back there you hear a lot of stories from people about how it's impacted them or how they feel, and that might be cancer patients or people that use the nutritional therapies that you were talking about. So what are some things, maybe what are some standout stories that you remember that have come out of the IV therapy suite?
I think one of the main ones, especially since we're talking about cancer anyways, would be just my recovery time from getting chemo, and that knocks most people out for a few days, just so exhausted and just not feeling right. And so then they'll get a vitamin C kind of the day after chemo, or a couple days after, and then they always report that just brings them back to life a lot quicker. So I think that's huge. Some people have more energy that day. I would say generally with the lower dose vitamin C and the nutritional ones, it's more of a, it's cleaning out every cell in your body. So it's not just a immediate fixes everything. It is like a low and slow and just does the work that's supposed to do. So you're sitting there and you've come 12 weeks or however often, and people are like, I didn't feel anything different. Then they'll stop, and that's my favorite, because they always come back. They're like, Hannah, it was doing way more than I thought it was doing. So I feel like it speaks for itself, and if you talk to any of our long-term IV therapy patients that have been just were faithful in doing that because they saw the big priority in it.
Yeah, that's such a good point, because it's like so many other things in life, right? When it's a subtle change, whether it be from a nutritional change and you don't realize how much more energy you have until you go back to eating your old ways and you feel sluggish because it's happened over time. So I think what I'm hearing you say is, because it's a little bit better each time, until they stop, they don't actually realize how much better they feel, or how much better they're being able to get through their chemotherapy treatments than they were without it. So that's a really good point. Not to make assumptions based on how you're feeling, but rather know what's going on. Now, I know we check in, and we have repeat panels and other labs we do to make sure that things are on the right track, and I think that's really important too. If anybody has been maybe thinking about it, or maybe read some articles and are considering it, but they're maybe afraid of it, a lot of times they're afraid of what we don't know, what would you say to encourage them?
Research it. There's so much good research out there. Riordan Clinic is the leader researcher, and I was just there, and they have literally 2 hallways full of published research articles about this. So I think that, yes, it might be scary, it might be new to you, but it's definitely not new. And so just really educating yourself. Our patients are the most educated people out there, truly. So just do that self-education,
and we would be happy.
We have so many good articles to send you if you have any questions. We have articles in the back that our IV patients can look at when they're back there, because it's so good to get that factual stuff. It's not just, this might work, this might not. No, it's the proof is in the pudding.
Yeah, so I would encourage all of you that are curious or interested in any way to reach out to us and let us know what we can do to help inform those decisions a little bit differently. Any final thoughts that you can think of as you think about IV therapy and what it's done for you and our patients and what you now know that you wish you'd done before? Any sort of closing comments that you would have on this topic?
A couple things. I know for myself it's been on the back burner just because it takes time. None of us have time. And so this last few months I made it a major priority. No matter what, I'm getting one a week. Like I have to do this. I have to put this at a high place in my life. I've been struggling with some random health things, and it's like, no, just do it. Stop pushing it off. Secondly, I think the coolest thing for me to see is once again like the proof of this working. We've been doing it for like 2 years now in October. This is the second year.
Yeah, it is no longer new at the clinic.
That's right.
Yeah.
And Dr. Lori said a couple of weeks ago, she said the biggest difference she sees in labs is when the biggest effector is when people use IV vitamin C. She sees their labs improve the most, the fastest, than any of our other therapies. So I think that's pretty much speaks for itself.
Yeah, and I think too, obviously nutrition plays a big role in what we do here at the clinic, and we do see people go off meds just from changing their diet. But I think what's really important about what you just said is when we think about the fact that people really do want to get out from under whatever they've been struggling with, whether it be cancer or whether it be an autoimmune concern, whatever it is, they really want to turn that around as fast as possible. And so in terms of efficiency and in terms of getting people there more quickly, IV therapy has been a big driver for our patients beyond just changing diet or taking supplements or managing stress and hydration and sleep and all of those things. It's a big, big booster. I saw a lot of comments, so I appreciate all of you that are watching and supporting us today. And for those of you new to the clinic, I love that you are opening your mind to some new information. I didn't see a ton of questions, so I will just watch the feed as we post this. And if you do have things that you want to know, feel free to reach out. We will take the time to answer those questions, whether it be on social media or you can feel free to call us or email us at the clinic. And for everybody, have a wonderful Thursday, and we will see you back next week one more time to talk a little bit more about cancer, and then we'll switch our Facebook Live theme going into the month of November to something a little different. So thank you so much for joining us, and we'll talk to you soon. Thanks, Hannah.
Yeah.